Welcome to appropriate use of the ER Iron DPC edition. Let's look at this flow chart here. So, you have a symptom. You don't know what it is. Is it a viral protocol that we all understand and know because we read the weekly Iron DPC newsletter that I send out every week? We have a protocol. My patients are educated on how to treat viruses, right? We don't need to necessarily have a contact. You come into the office to see patients because I want my patients to understand how to manage their own health, right? Iron DPC is different than conventional practices in that I don't get paid more by seeing you more often. That's the main difference between Iron DPC and regular practices. I want my patients to have health literacy, to understand how to manage their symptoms appropriately, right? I want to give them that knowledge. That's why I educate so much. However, you have an abnormal symptom pattern. You don't understand what this is. Well, you text us. You can text Iron DPC providers. You have a direct line of access to us if you have an abnormal symptom. Is it severe chest pain or something, I don't know, you broke your arm, something very bad? You call us, right? If you don't answer, you call us. Well, what if we really don't answer? What's going on here? Well, are you an older male? You have high blood pressure, diabetes, you're obese, you have a big belly. We're not answering the phone. You call 911, you go to the ER, right? You might be having a heart attack, something serious going on. You have comorbid conditions. You're not a healthy person. We're trying to get you better at Iron DPC, but that's a long road. We got to undo perhaps 30 years of damage, okay? That's not going to be happening in one visit. That's going to take sometimes years to reverse. You are a young female. You have a history of anxiety. You have low testosterone as a male. This makes you more anxious. You have more health anxiety. You can get anxious, sort of chest pain, weird sensations, tingling, weird stuff. You don't know what's going on. Do you call us at Iron DPC? Probably not. You can text us. We can figure this out. You can self-schedule an appointment with us at Iron DPC. You can go to the weekly newsletters. There's a self-scheduling link. You can book an appointment with us, right? We do not rush to the ER because we measured our blood pressure and it was high, okay? I want you to do a blood pressure log. I want you to put it on a sheet of paper over a couple days, take a picture of it, and bring it to us at the follow-up appointment. One thing, after working many years in the ER, I know the doctors over there, they hate it when a patient rushes in because they checked their blood pressure once and they checked it again and it went higher every time they took it. And so they go into the ER and they've been checking their blood pressure a lot and they got really anxious by looking at the numbers keep going up every time they took it. They go into the ER. What does an ER do for high blood pressure with no symptoms? They say follow up with your primary care. That's us, right? We don't need to bother the ER with unnecessary stuff. At Iron DPC, we try to keep our patients out of the ER, and we never, ever send our patients to an urgent care. That does not happen here, right? We can manage everything that an urgent care could do, okay? We oftentimes have a lot more experience than random providers that you will see at an urgent care. They do not have the knowledge nor the protocols that we have at Iron DPC. It is worthless to go to an urgent care. If you really have a bad symptom, you go to the ER. Alternatively, you text us. We can get you in sometimes, same day, same hour. We'll squeeze you into the schedule, even if there's no openings on the Elation self-scheduling, right? We can do that for you. But if it's something that we think is going to be just okay, and we're going to see you the next day or the next week, we'll let you know, okay? So that's our flow sheet here. Hopefully we can reduce the amount of burden we put on our ER system, right? The reason we don't want to burden the ER system is because the more patients that go to the ER, the more busy they get and the more mistakes they can make. We want them to see the patients that actually need to be seen so that they can treat chest pain, that they can appropriately send the patients to the cath lab to get that stent when time is heart muscle, right? We don't want somebody with a snotty nose sitting in the ER, clogging up the waiting room and burdening the providers over there. We want the ER to be used appropriately. The reason the ER is not used appropriately here in America and across the world is because of poor primary care. Primary cares that don't have time to see the patients, that don't have that direct connection with the patients that we do here. So Iron DPC is really improving the entire system by our flow chart here. We make sure that we never send a patient to the ER unless they actually need to be there, right? Unless they're having real symptoms that require emergency care. So hopefully that makes sense for you all. We're trying to do a better service for the system here at Iron DPC. We're trying to do a better service for our patients here. If we can figure this out right and we can apply this across the nation, we can really improve healthcare across the U.S. and the system itself. Thank you for watching.